Clearly, as we're moving forward into the future, healthcare is becoming far more integrated. And it's more than just the delivery of services that we're all very familiar with and probably have spent a majority of our career doing. And when we redefine population health, we're also thinking about how does that really comport to community health? How do we co-create healthy communities with other multi-sectoral partners in our communities? How do we look upstream at the social and equity determinants of health? And then how do we follow care back into the community and engage community partners? That's what we also continue to work on at the institution. So I mentioned that we serve a large portion of the safety net population in the city. A majority of our medical staff and our caregivers in the hospital are African Americans or other underrepresented groups. And so the populations we serve are the same population that also provide that care. And so in addition to looking externally and working on culture, we also look at that internally. So we make sure that the programs we offer our safety net population are expanded and offered to our population. We focus on diabetes, we focus on hypertension, the sickle cell community, the HIV community, etc. And so I would argue at Howard, the culture we're trying to create is a culture that is indistinguishable, whether it's external or internal. Again, because of Howard's unique history that's been embedded in the work that we do, many of our departmental chairs on the physician side, because we're an academic training hospital, have been leaders nationally and internationally in this space. So we do not have one designated position because so many of our physician leaders are involved in this activity. But I would argue that in hospitals and health systems across the United States, whether you're rural or urban or metropolitan or federal or whatever, having some key positions in the space of population health and or community health are fundamental for the success of the organization. And those positions should be both physician and or other clinicians and non-clinicians, because it really takes a team effort, multidisciplinary effort, to improve community health metrics or improve the health of our population. Well, we are re-engaging. Part of the reason I came to Howard was because of my interest and my background in collective engagement, community development, etc. And so we are attempting to rediscover who we are, taking the best of what we've stood for over the last 150 years, especially working with underrepresented minorities within the city and also training such health professionals for the nation. And how do we then take all of that good work we've done and rediscover what we can be going forward and replunging, as we say, into the community, because we've recognized that Howard, we need to go to where our populations need to have access to care instead of having them historically come to the main campus. And so it's really going to and meeting people where they are in their circumstances versus being a historical asset-based organization where we ask people to come to us.